So I'm been roped into chairing today, so apologies that I'm sat in my chair at home. If we just run through the agenda, because it's quite packed out today, really. And then I think we'll do some introductions when we do the updates from the organisations, if that's okay. So I think that Stacey's put the agenda in the chat. So we're just going to have a quick recap on the email that went out about the updates from the last meeting and where the information goes from this meeting. And then we've got about 40 minutes for updates from organisations, just to get an idea of temperature gauge and like themes and how we prepare for challenges that are coming up next. A brief talk from Delvina on the BAME Health Inequalities Funding, a brief talk on update on vaccines and testing, and then Advanet are doing about a 20 minutes presentations on rights, what's changed, what hasn't, and how we can support those. That's a quick recap of where we're at. Can I just ask if anybody lets Stacey know if they're not okay being recorded as usual, or let her know in the chat.
Thanks, Wendy. Shall I just have a quick recap of the last meeting?
That would be fab.
Yeah, so we had Tony and Shaq come along to talk about the vaccine and the programme and what that might look like, and what the potential rollout would be over the next 9 to 12 months. As you can imagine, it's quite fast-paced, information is changing, guidance is coming out around that, and I think we have got something that we can share when we share the notes as well. The COVID updates, we have got the numbers, and again, sorry, I've not got those at the moment, but I think generally, on the whole, we're doing okay. Numbers are decreasing. There's quite a, we've got all the numbers, and I'll get that from Mindy, which goes into a little bit more detail. Some of you might have already heard that, but like I say, we can share that. As you know, Healthwatch have done a survey around the vaccine and people's thoughts on that. So hopefully everyone's had a copy of that survey as well. But if not, please let me know and we can send that out. Contact tracing. So as you probably know, the Connect and Support service is now live, and for those of you that might not be aware, that's where the national test and trace system, if they can't get hold of people, they will be passing that on to local level, and some organisations will be picking that up and contacting people where appropriate. And I think that's it for the recap. And just to let people know, you know, all the information that we capture at the Communities of Interest meeting, it is all fed into other meetings as well. So it helps to shape, you know, decisions that are made throughout the rest of the city as well. Is that okay, Wendy?
That's fab. Thank you, Stacey. It's really useful to know that the communities of interest have a role not just to pass on information to their communities, but it does go through to where it needs to go to in health and care. So we've got a quick, well, a fairly long time for updates from organisations. Shall I just say your name on my screen as I go around, and you can give a quick introduction and a really brief update? There's quite a lot of people on, so can I ask that we just keep that to a couple of minutes if possible, if that's okay? So Emily, you were first on my screen there.
Hi there. Sorry, I'm Emily from Women's Lives Leeds, coordinating a movement for Leeds to become the first UK women-friendly city. The main thing for us really is we have heard some feedback that women were quite significant in the numbers that were concerned about the vaccine. So we're just going to, in our next newsletter, but do a little bit, which will be next week, do just a little bit of a call out to see if we can get any further information about that. So that's really our main update. Thank you.
Errol?
Hi, not a lot to update with. Reflecting on the event last week, it was really lots of good information coming out of it regarding the vaccine. Still talking to lots of dads and families, no interest whatsoever in taking the vaccine, no trust whatsoever in taking the vaccine. I think there's a bigger piece of work to be done within the community for that sort of confidence to be built. And otherwise, we've got a 12 days of Christmas event coming up, starting on Sunday, where we'll do virtual playhouses, just music, dance, for children and dads and mums to enjoy a play group if they can't get out. Just ask me for more information. Thanks.
So we will be giving an update on vaccines and testings at about 11:30. So I think some of those issues that people have mentioned, it'd be really useful to think about how we can support those in terms of take up, or what people are saying they're likely is going to be the likely take up. Delvina?
Morning everyone, I'm Delvina Saunders, the new BAME Mental Health Inequalities Project Coordinator. Very long title. But we do have some updates in regards to the grants programme. Do you want me to go through those now, or do you want me to wait until the third point in the agenda?
It's scheduled into the agenda, Delvina, so
okay.
We'll do that then.
Okay.
Anna?
Morning everyone, I'm Anna from Healthwatch Leeds. I'm here on behalf of my colleague Harriet, who works with young people for us. I'll go through these updates really quickly. You might have seen one of our volunteers have been involved in a video about Black Lives Matter created with Angels of Youth. I'll put some links in the chat. It was in the Yorkshire Evening Post this morning, so I'll put the link to that, and then you should be able to see the video from there. It's only quite short, it's only about 3 or 4 minutes. We're also anticipating doing some work with public health about top tips for young people for surviving self-isolation. And just a quick word about the COVID-19 vaccine survey that we're running at the moment. Responses from young people have been relatively low. So it'd be great to hear a bit more from them if at all possible. So please do, I think Chris has already shared a link in the chat, so please do share it on your networks if you, especially with younger age groups and culturally diverse communities as well, please, if at all possible, like Chris asks. Thanks everyone.
Thanks Anna. Chris?
Hi, I'm Chris, I'm the engagement manager at the Clinical Commissioning Group. I guess it's my job to make sure that when we make changes to health services in Leeds, that we're involving patients, carers, the public in those service changes. Thank you.
Abigail?
Morning everyone, I'm Abigail Lally, new project worker for Voluntary Action Leeds, and I'll be working across the BME Hub and Young Lives Leeds. Just here today to observe, it's my first week, so moving forward, hopefully I have more of an update for you, but Annette is on the call and she can probably fill you in and some of the things that we've been doing. Thank you.
Thank you, Abigail. Victoria?
Hello everyone, I'm Victoria Silver and I'm an advocate at Advanet, working alongside Wendy.
Thank you, Victoria. Sam?
Morning everyone, I'm Sam Powell. I work for Leeds City Council's Communities team. I work on migration and third sector partnerships. From us, just a brief update. I shared yesterday in the task group that I chair with Public Health on key messages around COVID. There's a new testing and self-isolating infographic that has been produced. And this is to help people to better understand how testing and self-isolating works. And it's been translated into 12 languages. So I've just received the translations for that. and I'll be sharing it with Stacey and Pip to circulate amongst the group. It might be useful to talk it through with people. Sometimes you try and make things really clear in an infographic, but then still people might need some explanations to support it. And if anyone has any questions, you know, more than happy to come to me. Yesterday in our conversation, we was also talking about how we can build on this and perhaps do a video or an audio in different languages to help support the infographic. But it has been created to support the local Connect and Support service. The Migrant Access Project, so we work with migrant community leaders through MAP, and there's been lots of concerns about the vaccines. Community leaders are keen to help communities understand the vaccines, but they have lots of questions themselves, so we have fed that back. We've been looking at the census that will be in March, I believe, next year. So members of the team have been looking at how we can engage communities, especially those that are furthest away from engaging with the census. On the destitute asylum and agenda, so those people who don't have the status to be in the UK who have been destitute. Previously, in the first lockdown, we had the everyone in, but since then we haven't had the same policies nationally. So locally, we have been able to find some funding which will support European and non-European nationals over the next few months with temporary emergency accommodation. On Brexit, we will exit the EU, is it the 31st of December? And there's loads on the news about that, but we're really promoting the EU settlement scheme. It's been extended for an additional 6 months, but we're not wanting communities to sort of wait until the end of that period. For some people, it can be complex getting access to passports or overcoming the barriers of the paperwork. And there is some support available. So I will share an update on that. So if you do come across clients who need that support, please do signpost them. And finally, again, on asylum, there are a lot of people coming into the country. I've mentioned this before, but the challenges around COVID has made move on very difficult. So across the country, people are being accommodated in hotels, and also in Leeds, people are being accommodated in hotels. We have about 250 asylum seekers accommodated. We have been meeting with them through Zoom focus group sessions to listen to what some of their concerns are and how some of the support could help them. You know, I'm sure it's very, very difficult being holed up in a hotel room. So we've worked with public health and we've allocated some funding to support their physical activity and wellbeing activity. So we're looking to administer that over the next 3 months. As we anticipate the hotels will start to shut down in April. That's kind of it from me, I think.
Yeah, hi, Amber from Basis Yorkshire, working with women who are sex workers, women who are sexually exploited and young people who are sexually exploited. Not terribly much news since I haven't been on there for a while, I know, but I think my colleague Moya was on a few weeks ago. Not much updates since then, other than some concerns about vaccine from some of the women we work with, although we haven't asked everybody, so it's impossible to say whether that's just the ones who have mentioned, you know, that whether everybody feels that way or whether that's just happens to be the people that have mentioned it to us. So I wouldn't want to take a call on that, but some people have expressed concerns, let's put it that way. And just general mental health continues to be an issue, particularly in the run up to Christmas. That tends to get even worse now. It's even more so. And what was the other thing I was going to mention? Yeah, young people's work is actually, I guess since schools have opened, our referrals have kind of not quite gone through the roof, but quite high with quite significant risk. And we're now full, but please continue to refer because we do that on a risk-based assessment. So if there's and the other slight issue I suppose we see is that typically pre-COVID with young people, we were able to refer young people to other groups that they might be able to take part in, and that's just significantly reduced, I suppose, since COVID. So in terms of when we finish working with somebody, we'd like to kind of offer them another place somewhere else, or whether they could still be involved in other activities with other young people. That opportunity is reduced. That means we're working longer with people, and that doesn't help either. But yeah, those are the main messages, really.
Thank you, Sam. That's lots of stuff. Amber, thank you, Amber. Jay?
Hi, I'm Jay Anderson. I'm the Secretary for Leeds Faith Forum. I'm here on behalf of Simon Phillips, who is engaged because it's Hanukkah. So I'm here in his stead today. Two things to bring to people's notice. The Faith Covenant consultation will be going live shortly. The deadline for any comments on it will be the 4th of January. The other thing is that the strategic faith leaders meeting with Leeds City Council, there was the offer that Jeff Turnbull is going to pursue with regards to offering faith spaces or spaces that belong to faith communities for vaccine hubs. So he's going to follow that one up. So I might have some news about that after the next strategic faith leaders meeting, whenever that is. But yeah, that's it from me.
Thank you, Jay. Owen?
Probably a similar message to before. There's definitely, more complex kind of cases coming forward. Sorry, I'm Owen. I'm the manager of Leeds Autism AIM. And I guess we've started having those conversations about vaccines, and people kind of are concerned that when they're having conversations with people, they're not equipped to have those conversations, and that, kind of we would approach those conversations from an advocacy point of view. But I just wonder if there's an ask to say that we could have some difficult conversations training around the vaccine, so that people feel a bit more equipped when they're having those difficult conversations with people. There was also a kind of query around, like a lot of people don't like needles. I'm aware there probably isn't an alternative to needles. But obviously there needs to be some work around reassuring people about using needles, and trying. I'm sure there's techniques out there for helping people feel a bit more confident going if they do have phobias or fears around needles. So that would be a good thing to get some clarity on. Other than that, we've got a Christmas survival guide and some peer support groups over Christmas. People. That's all from me.
Thank you, Owen. Rachel?
Hi, I'm Rachel. I'm from Carers Leeds. So we've had actually a really hectic week. We've had a lot of things launched this week. So we've been involved in a letter produced by Leeds City Council in partnership with the care homes that's been sent to families of residents in care homes, just to give them some guidance, especially with all the new guidance that came out on the 2nd of December. So I'll share that to be circulated. We've launched a digital project this week as well. We've now got digital champions and devices to help carers feel confident online and get connected. A pilot's also been launched this week with Leeds City Council and Public Health to provide family carers with free PPE. So again, I'll share the link on the chat. That's a really good success story this week for us. We're buzzing about that. We've had a good response to our winter newsletter, and we have got funding for a spring edition. So close to the time, I'll put a shout out for us all to contribute towards that. It was a bit of a rush in the winter one, but I'm very conscious that we need to help each other, share messages and promote each other. So I'll definitely put a shout out. I'll be a bit more involved in that one next time. But yeah, I'd definitely echo what Owen's just said as well. We're having some difficult conversations about vaccines, and I know that more information will come about that, but that seems to be definitely more of a topic. We've had a few calls just checking what they're supposed to be doing in the guidance, and that's kind of filtered out now, but we're definitely getting more calls about vaccines. But yeah, that's the state of Carers Leeds at the minute. Thank you.
Thanks, Rachel. Toshal?
Hi, I'm Toshal Bhatia from Help for All. So
Please.
in terms of currently we obviously pre-Christmas, we are doing some sort of winter support packs for a lot of BME older people, but including anyone over 50 that we have been working with, spreading the messages around. I think there's been quite a few feedback, people asking about vaccine and if they should be. So because we also have public health funded Better Together project, we've got the leaflets sent by public health that we've been sort of, you know, staff have used that to give some information to make sure that people are still, you know, sort of not anxious about it. We've received the infographics. I think somebody mentioned about, Sam mentioned about it. So we have been using that as well to pass it on to our beneficiaries, or you know, anyone who sort of would be useful. Community centres are, you know, running still the mental health support groups that are allowed, and breastfeeding support group for young parents, which we are quite, I think that's the only face-to-face breastfeeding support in the region. Many others have still not started face-to-face, but we picked up on the mental health needs of young mums really, or parents. So we just restarted it last month. Apart from that, just food parcels, Christmas packs for families that we know will be struggling throughout the Christmas period. So that's where we are.
Thanks, Toshelle. Jen?
Hi everybody, I'm Jen Bravo. I'm TLA Services Coordinator. Just in terms of that, we're still dealing with, as everybody else is, COVID-19. We've got a scheme that's had an outbreak. So we're just getting to grips with that in terms of multi-agency working, and there'll be some work done around any lessons that we've learned that we'll look to cascade across the organisation. Obviously, we're very interested to know where we fit in terms of vaccinations for our staff. So I'm looking forward to any updates in respect to that. Staffing still an issue in terms of people isolating and people testing positive or having to isolate. And just concerns continuing about well-being and staff morale, as I'm sure everybody else is experiencing.
Thank you, Jen. Sophie?
Hi everybody, Sophie Peel from Hamara. So yeah, to echo what everyone else is saying, really busy. Things don't seem to be slowing down. Cultural food parcels, I think we work with now 20 partners across Leeds City Centre, and each one of those gets about 25 to 30 per week. And then we have our food bank at the main site on Tempest Road, and again around about 30 to 40 parcels per day going out of there. We're remaining open over the Christmas period, so we'll be delivering our hot food out to our regular neighbourhood networks members who need that for the full 5 days over both those Christmas 2 weeks. And we'll have an emergency food bank open on the Monday, Tuesday and Wednesday of both those weeks. I can share a timetable of our activities with everybody after the meeting. In terms of all our projects, everyone's kind of still online, and we've had a few groups start again after the lockdown. So our men's walking group has started again in Cross Flats Park. And what's been really great this month is that our neighbourhood networks teams have managed to get some of their users online for an online sewing group and some online one-to-one sessions, which is just absolutely fantastic to see that people are still learning new skills. So yeah, just very busy. The thing that probably will interest you all most is that our patient ambassadors in South and East, their roles slightly changing to cope with the rollout of the COVID vaccination. So they'll be supporting the GPs in calling the first sort of client group to be receiving their vaccinations. And we've kind of just been speaking about it today, that they're expecting, you know, some conversations around, some difficult conversations with people who maybe don't want to take the vaccine or are fearful. And they've just been advised to just refer back to the GPs, you know, because obviously they can't offer that medical advice, they can just offer the kind of support. But yeah, we'll update more on that as it goes along.
Thank you, Sophie. Sarah?
Hi, I'm Sarah Bronson. I work for the Leeds Academic Health Partnership, and I've just been very kindly allowed to join and observe. I was communicating with Daisy yesterday, I'm helping council colleagues who are looking at the rollout of the COVID vaccine in the city. And there's a group of people in Leeds, Bradford and other places in West Yorkshire who really want to think about making sure that the health inequalities are not exacerbated by the process of the rollout. So I've just joined to observe and to hear the conversation that I think you said was going to happen at around 11:30. Thank you.
Thank you, Sarah.
Marie Haddell. I'm temporary admin support and I'm representing Sam Prince, who's the senior responsible owner for the project, and Simon Clouderet. So I'm here basically just to make salient points and pass them on. We do get a lot of information regarding from the comms representative, Shak Rafiq, who's very good. So we do disseminate all our information to the people on the vaccination steering group, who meet every Thursday. So I'm basically here just to make salient points and pass them on to Sam and Simon. And I think a colleague of mine will be taking over my role because I'm going back to my substantive role next week. Thank you.
Thank you. Can you just clarify where you're from?
Yes, sorry, I do beg your pardon. I'm from Leeds Community Healthcare.
Thank you.
Thank you.
As Abigail said, yes, she's be taking over from me in the new year, but for the time being, I'm still doing the work. So from, I suppose, any updates, really, one of the main things that is a concern within the culturally diverse communities is the vaccine. We had some consultations a couple of months ago before the vaccine came out, and they proved to be, well, the outcomes weren't very good. So it left people with a really bad taste in their mouth. So they're not very positive about the vaccine. So we've been doing our best to promote, send out information, update people and make sure that they get accurate information about everything that's going on. So we've been working quite closely with Sam and her team around the COVID messages. So that's been happening through our newsletter and through our ad hoc whenever we need to. Also, we've had some discussions about digital poverty, and one of the barriers for particularly certain culturally diverse communities accessing support because of digital poverty. So some of the organisations were looking into how they can support organisations to get the training, because sometimes it's not just about them having a device, but it's about them knowing how to actually use that. So some organisations are looking into that. We had a discussion at one of the meetings this week around that digital agenda, what's happening, and the report that's out that Health Watch has done. So hopefully we'll be able to continue with those discussions to identify how communities going forward can be supported better. And then, as some have already mentioned, the communities are still feeling that food poverty is a big issue, and going through the winter period over Christmas, some communities, even though they've been receiving food parcels, because of their circumstances, sometimes don't have facilities to even cook. So hot food has been their only sort of lifeline. So that whole kind of food issue is still a big problem. And also mental health across the spectrum of culturally diverse communities, young, the elderly, women, sort of everybody really. And just to mention some of the stuff I'm doing on my women friendly Leeds work as a women's hub development worker. The Women's Hub, we've got Culturally Diverse Women's Hub now, and the Women's Hub have been looking at some of the opportunities they can provide to support women going forward, so support culturally diverse women. So we've launched a new group which is called Time Out. So if you see a flyer that says Time Out, it's a group for women who are experiencing domestic violence and abuse, but we've called it Time Out. We've not put anything in the flyer that sort of relates to that, for fear of women might not be able to access if people know what it's about. So if you see that and you know women that might benefit from it, do pass it on. And also just to say, I am changing roles, and when I come back in the new year, I'm going to be picking up a project that's going to be looking at underrepresented communities, and developing underrepresented communities in strategic leadership. So I'll be doing a pilot project for a year, working with communities, but also working with organisations to look at their board structures, to support them to ensure that their boards become more culturally diverse, more reflective of the communities that they serve. So I'll be promoting some of that. So I'll be probably connecting with some of you on a different sort of platform. So yeah, thank you.
Phyllis, is there anybody who's not been?
I've not been, Wendy, and I need a little bit of extra time because I've got Karen and Carl's updates as well. So in terms of the outbreak plan and the funding for third sector support groups, that's going really well. Just to update people that for the culturally diverse communities, we've approved 20 grants, and a lot of them are well underway at the moment. For the young people project, we're just getting some of the evaluation back in, and we've got some art illustrations that Tom Bailey's done, so we'll be sharing those over the next couple of weeks as well. But they're absolutely fantastic. A reminder to people that we've got the faith sector webinar on the 16th of December. I think we've got 6 people that have signed up for that. And again, that's just around bringing those communities together, offering support around grant funding and that networking. And we've been thinking about what the next steps will be. So broadly, what we thought it would be around to target in terms of the grant funding would be people with learning disabilities, autism, long COVID, and men, not all together, possibly separate, but possibly if there's any crossovers as well. So I've met with Jez, and we're just starting those conversations around the learning disabilities sector to try to get some information around that, see what the barriers are, what support might be needed. But hopefully I'll have an update for you at the next meeting. Just to pick up on quite a few people just to let you know as well that the evaluation team are now in post around the outbreak plan and the communities of interest. So what that might look like going forward is that some of the evaluation team might want to contact you or some of the people that you support. But what we've agreed is that I would make that introductory email to the evaluation team, and then they can give you a little bit more information. But we're looking at survey, light touch telephone calls, and in-depth conversations, which will last around 30 to 40 minutes. So if anybody would like to get involved with that, that would be fantastic. Yeah, so heard quite a few services are busy. So I attended the Routes to Support meeting a couple of weeks ago, and I think the question was around how do we know when third sector organisations have got delivery pressures, and is that trust there between commissioners and the deliverers for them to be able to feed back to the commissioners to say, actually, we're struggling, we need more money, we need not more support, or potentially we're taking less referrals in or more referrals. So we've agreed that we'll put something on our website. It's just in the development stage at the moment, but it'll be a little bit of a feedback form where you can feed back to us, and it could be anonymous if you know, if that's what you wanted, but and then we can feed that back into the Routes to Support meeting. Oh, sorry, now another update. So Yorkshire Evening Post are looking to do an interview with Carl around the communities of interest work as well. So some of you might have seen the short video that's been shared. I think it's about 30 seconds, seeing the empty streets of Leeds. So there's going to be some more work around that. And we're hoping to be able to get some pictures, photos with consent or videos, thanks Daisy, that people can share with us so that we can share with the reporter. So if anyone has got anything, you know, any great work that you want to share, if you want to send that through to the community's inbox. And Daisy, did we agree that we would need a signed consent form? So I've got a bit of an update from Karen.
Oh, I'm not sure, sorry. I think
Okay.
Carol knows, yeah.
Yeah. So yeah, there'll be more about that. Anyway, I'll put that in the follow-up notes. So Karen Fenton, they've got a film on YouTube about a young lady who shared her experience of trying to find a job during COVID. And again, we'll share that link in the notes. The International Day of Older People session that was run, so mental health, social isolation, employment, hate crime and loneliness came up. Some interesting conversations around intersectionality and the levels of discrimination and barriers that people face at an institutional level and with communities and families. For example, people living with a long-term condition, ethnic minority, a really big word, I think it's neurodivergence, and learning disabled, physically or sensory impaired, and identify as LGBTQ+. So there were some conversations around the accessibility of public spaces and the impact of COVID on disabled people. There were some slides presented about the ongoing work at the train station in Leeds and the development, and some feedback was that it looks great and they can't remember what it looked like before. And because they've not been out since March, it's difficult to remember what anything looks like anymore. And that's it. Thank you.
Thank you, Stacey. Sam?
I'm sorry, Wendy, I have been, but Annette reminded me to mention the Cultural Food Hub. So I support the 2 cultural food hubs for Leeds, Hamara and Give a Gift. They will be continuing over the Christmas period. I'll share an update so you can share it with partners. Give a Gift office will be closed, but they will be picking up an emergency food parcels, and they cover the east of the city. Hamara cover the north, west and south. They will be open every day, including bank holidays. And the 2 cultural food hubs will work together over the period so that they can respond to emergency need. And just to mention as well, as you know, the Cultural Food Hub works in partnerships with organisations across the city. So whether that be the community hubs that are dispersed across wards, or any organisation that is supporting people with food, they can get in touch with the Cultural Food Hub and ask to work in partnership and receive a supply of food that they will then redistribute. They usually will receive it in bulk so that they can make up food parcels or complement the food parcels that they're doing. So just a reminder that any organisation who's supporting with food can also get in touch to access cultural appropriate items. Thanks, Wendy. Sorry, I forgot.
Thanks, Sam. Is there anybody else who's not been who wants to give an update?
I don't have an update, but I'll just say hello to everyone that I haven't met before. I'm Daisy. I'm the member support worker at Forum Central, so I work with Stacey. And then Gabby's here as well, who also works on our team.
Hi, yeah, sorry, no update, but yeah, hi, I'm Gabby. I'm the Third Sector Relationship Officer.
Thank you. For really unusually, we're slightly ahead of time, which I actually can't believe, but I think that's really useful because we can give a little bit more time to talking about vaccinations and testings. But because I'm conscious that Delvina's here and might not want to stay for the full meeting, do you want to give your update about the health inequalities, about the inequalities funding?
Yeah, good morning, everyone. I'm Del. I'm new to this post as well, so I've only been in this role for about 3 weeks, so the majority of it has been about inductions, but a part of my role is to kind of work on the grants programme. I hope you can still see me while I'm just reading this information as well. And we're looking at the Addressing Mental Health Inequalities in Minority Ethnic Groups grant. And when I looked at some of the guidance and criteria surrounding this grant, I was really quite concerned that a lot of the grassroots organisations and some of the bigger organisations that we've got as well wouldn't be able to meet the criteria, even though they're all doing really great things in the community to support mental health and community action. And therefore we've had some of the guidance and criteria changed just so that it's a little bit easier for people to be able to apply for some form of funding. and that the application form will be a little bit easier as well. I've also had the deadline extended till the 20th of January because I was just conscious about the fact that, you know, what we're having to do everything from home, online. We're coming up to the festive season as well, which was just very time limiting. And the fact that I've only been in this post for a very short amount of time. So I was just conscious about the impact and whether they are organisations that actually genuinely know about this grant and how to apply. So we are going to be having a briefing event that's going to take place on Tuesday, the 15th at 10 o'clock. I'm going to ask that it's pre-recorded and then maybe somewhere for people to be able to view. That'll be an opportunity for people to really have an understanding and an opportunity to ask any questions surrounding the criteria, what the funding is going to be for, what the objectives are, and how we will measure success moving forward. So the grant will be able to the project that people are running, grassroots organisations or charities. It should be address one of the following. So it should be building capacity, reducing stigma and increasing trust, access to early intervention for developing mental health issues, and influencing positive community action and promoting community resilience. And one of the great changes that we've made is that we are now open to be able to allow some of the bigger organisations to support smaller organisations as a partnership, so that their projects will be a lot more successful. I'm also looking into running a couple of drop-in sessions as well before the deadline closes. So it'll be myself, maybe someone hopefully from BHI or the Feel Good Factor and the Leeds Community Fund. And if we can maybe run some drop-in sessions at a location like Tech North, so that some of these organisations that may have not seen the webinar on Tuesday, they can drop in, we can go through their application with them, and then just kind of look at what we can do to support some of these organisations to make sure that they are more successful and lined up to be able to apply for continuous funding in the future. So what I'll do is I will put some information in the chat that we've got that kind of just talks about what the grant size is and what some of the criteria is as well, if anyone is interested in putting that out there. And
Thanks, Davina.
That's it for now. Thank you.
Thank you. It's great that you know, it's been really thought about how those smaller organisations might be able to apply for some of that funding and some of the barriers they often have in applying for funding.
Yeah, and just about whether it's really being publicised as well, because a lot of people don't really know about this funding opportunity. So I've been reaching out to quite a lot of the smaller grassroots organisations, and you know, I've had a chat with Annette as well, who's been great, and also Karina from Feel Good Factor. And we're kind of talking about how we can reach out to some of those smaller organisations so that we can make our community stronger. So I'll put those details in the chat, and if anyone would like to join the webinar on Tuesday, feel free, or I'll put my email details in there as well if you'd like any more information.
Thank you, Delvina. So we've only got 5 or 10 minutes for an update on vaccines and testing. I'm not sure who at Forum Central was doing that. Is that you, Stacey?
So it's not an update as such, really, and I think the vaccines, we've had quite a bit of feedback. I think it was just really to make sure that everybody had an opportunity to kind of mention the vaccine and what their concerns were. And I think I covered the Connect and Support service earlier.
Thanks, Stacey. Just very briefly, you might have seen our weekly check-ins, which are focusing on the vaccine at the moment, and you'll have had a few emails from myself about this as well. We're compiling a report today, which is capturing as many of your observations as possible. So huge thanks to all of you who sent that through either via Iona at Leeds Voices or via Daisy. So that report will be coming out Monday, and I can send a copy to everybody actually, just to give you a bit of an overview of all the different community voices that have come out about this. And I'll be in touch with some of you again next week, if that's okay, just because I've heard some really fantastic insights at this meeting, and I'd just like to follow up if that's all right. So yeah, I'll be in touch. Thanks everyone.
Do you want to add anything, Anna, on the Health Watch work, or have you covered it?
So I suppose it's just really important that we get in touch with you, Anna, and feed in some of the things in more detail that our communities are seeing, particularly if they're maybe not completing a survey, or they might have some difficulty completing that survey, that we can pass on those experiences to you.
Please do, yeah. I think pretty much everybody should have had some contact from us now, but do just get in touch. I'll put my email in the chat, or give us a ring. It's usually me that answers the phone. So yeah, really looking forward to reflecting that in the reports.
I think just if I can just say, I think it's really important as well that we work with sort of Anna at Health Watch to sort of demonstrate what we're doing differently in response to the feedback as well. So there will be something that's produced to sort of say, you know, this is what people have been telling us, and this is how we've rolled out the vaccine differently. So that will be in the post.
Just to chip in, we were discussing this yesterday in the task group I chair with Public Health, and we were discussing the results from the Health Watch survey. My colleague in Public Health was referencing where CCGs were looking at mass communications around when, where and why, but he's looking at developing that communication with partners around the misinformed and the rumours, to help work with partners to create that understanding, and that comms will start to get developed. One of the things that was stuck in my mind from that discussion and from the Health Watch report was how do we turn people's no's into yeses, and the focus really on how we do that. So it's something that I think from the discussions we had yesterday, we're really keen to see this comms ready now, because it's so much in the media, but also an acknowledgement that it's really important to get it right and to work with partners in facilitating that message. And Stacey, your comments yesterday was also really useful contribution to consider. I don't know if you want to mention that.
Yeah, so is that around staff and services feeling confident in the vaccine as well? So just some things that I've picked up in several meetings is that us as services, as organisations, we're people too. And some of the feedback is that actually we might have concerns around the vaccine. We might not understand, you know, everything that comes with it. So, so like Sam said, I fed that back in because I know that there were a couple of concerns, and I think, I'm not sure if it was Rachel at Carers Leeds. Did you sort of agree on the whole that as an organisation you would promote the vaccine, even if the staff possibly
had
concerns?
So well, we've just said as the Carers Leeds, as an organisation, we're behind the vaccine, so we're going to promote all the key messages, we're going to talk to carers about it, we're going to help them come to their own decisions, and so I suppose we've just as an organisation made that decision regardless of our own personal views, but then, you know, alongside that, we're looking to hopefully answer any queries that the staff may have. We're looking at our guidance for community-based visits and looking at PPE, so that we're covered either way. But one thing that we are particularly concerned about is if our client group see the vaccine as a barrier to connecting with us. So if they start asking us and individual staff, have you had the vaccine? If you haven't, then I don't want to come and meet you. I don't want to come to the group. I don't want to come to any sort of events and face-to-face groups. So that's where we are at the moment, if that helps.
It does, Rachel, thank you. I know that there were a little bit more to that than what I'd said, so thank you.
Stacey, one other quick thing. I don't know if it's possible, with us maybe being quite good for time, whether it'd be worth me sending you this testing infographic and sharing the screen of it, because we talked about it yesterday, and actually that discussion helped us realise where communities might find a bit of a challenge understanding it. Do you think it's worthwhile just sharing your screen with it?
So Wendy, how are we doing for time?
Sorry, we're actually on time, but we're not ahead of time at the moment.
Right, okay.
I wonder
We can
if,
send it round after, Sam, if you could send it, that'd be great.
and if we finish earlier at all, if in the any other business, if we get a chance to look at that, that would be fabulous.
Yeah, I think it would be. I think some things came out around that, didn't there, Sam, about possibly not feeling confident with it. So it'd be good to get some feedback. But yes, we'll see what time we've got. Thank you.
I'll just ask a really quick question around when, if there's any news on when third sector staff will receive the vaccine. So obviously it does influence service delivery, and it'd be good to kind of have at least a ballpark figure, if not a specific one soon.
I can chip in with what we talked about yesterday, where they gave a bit of an update, and it's not really a specific answer to your question, actually.
Yeah.
But they gave a bit of an update yesterday about how the vaccine comes in batches, with 975 in each batch. We received a batch at the beginning of the week, which went to those at the vulnerable end of the spectrum. We expect another batch to come next week, which will be prioritised to care homes, but that's looking at the West Yorkshire region, whereas this week we got it just for Leeds. I know within the discussions the communities team and my chief officer's been having is been strongly supporting that the third sector frontline services get an early access. But I can take that question away and come back to you with a bit more information.
Yeah, that'd be great. Cheers.
Fabulous. Well, we're on time, so shall we move on to doing a bit of a talk on rights and kind of legislation during this COVID period. So if you don't mind sharing the screen, Stacey. So we're really conscious that you're all experts in your own areas. You know your areas of legislation really, really well, but there's loads of myths out there. You know, we're hearing things about, DNAR, from autistic people, for example, or people with learning disabilities saying about DNARs being put on in blanket ways. I think these are kind of national messages that are coming out that we just want to help dispel some of those myths. Actually, Leeds is being quite proactive in trying to ensure people's rights have been met, but there's still some concerns in this period and in the coming period about challenges there might be to making sure people's rights are met. So it's a quick run through really through some of the legislation, what's changed, and more importantly, what hasn't changed during this period. So this is just really a real whistle-stop reminder. You know, within advocacy, we have loads of specialist knowledge about changes in legislation with loads of areas, and we're clearly not going to go into any of that. We could do a day in each one of those slides, but just kind of, we know that human rights are absolutely essential to making sure we've all got fair and equal treatment during this time, protecting diversity. There has been very little changes to law during this period, but there has been some concerns in some areas, so we need to be prepared. But it's the myths that we're most concerned about, I think, as well. We have that focus on the human bit in human rights within our own organisations, but what do we have to back that up? What do we have to support us to make sure that the communities we support, human rights are met? So I'm going to really run through a brief overview of laws and legislation during COVID, and some of it will be things that you're really familiar with, but just looking at what has and hasn't changed. But really, I want to find out from yourselves on what themes you're seeing and what information you want in future in more detail on rights or legislation. So the British Institute of Human Rights did a survey in August on staff, carers and users, and they did a presentation to the House of Commons and the House of Lords with things they were really concerned about in this COVID period that they've been seeing nationally. That doesn't mean we've been seeing this locally. It means that it's concerns that have been raised from the British Institute of Human Rights, and I think it's just things for us to keep an eye on. So they found really worrying things, really, that about 70% of people said their care and support got worse during COVID. And, you know, nearly 30% said they'd experienced health or support being taken away so much so that one of their human rights around maintaining dignity can't be upheld. A quarter of people said that while they used to be involved in decisions about their care and support, that had stopped during COVID. 16% said life not being protected because of reduced services, 10% experiencing the use of do not resuscitate orders without involving the person, and almost 60% feeling less confident to raise their concerns about human rights. Now, some of these things we haven't seen in Leeds, so there has been involvement. We were checking again with Leeds teaching hospitals about do not resuscitate orders being used, but these are concerns that are seen nationally, that are being promoted nationally, and it's important for us to be aware of what people might be concerned with. So kind of responsibility is on us supporting people. That almost 70% of people said they weren't provided with information on how to, that their human rights hadn't changed. 60% weren't told about how to, the legal basis, if their care and support changed or reduced during COVID, and how to challenge that. And over 80% of staff said they were finding it harder to uphold human rights. 3/4 haven't had any training on how that might be affected during COVID. And over 50% said they'd experienced restrictions being put in place, which might impact on people's physical and mental well-being. And 50% that experienced decisions being made which impacted people's rights to non-discrimination. So this is a national survey done in September with those reports, like I say, that went to the House of Lords and House of Commons. So it's just areas for us to be aware of. It's not necessarily anything we're struggling with locally. So briefly, human rights we'll all know about, and making sure we're all treated fairly with dignity, respect, through the Human Rights Act, which we still have at the moment, even though we're in all those discussions about adjusting or coming out of that. There's 16 rights. This is a foundational law, so all the other laws and legislation are connected and apply to the Human Rights Act. So things like right to life, right to freedom from inhuman and degrading treatment, right to liberty, right to respect for private and family life, right to manifest your religious beliefs, right not to be discriminated against. These are some of the things that the British Institute of Human Rights were concerned about during the COVID period. The Equality Act connected to that. So those 9 protected characteristics, that public sector equality duty on our health and care services is unchanged during COVID. So things like do not attempt resuscitation orders can't be applied due to age or disability. That is something that was happening nationally. We haven't been as concerned about that locally, but it is something that people are concerned about because they've been hearing news articles about it. So making sure that we remove or minimize that disadvantage, taking steps to make sure proactively to meet the needs of people, encouraging people to participate in public life where it might be disproportionately low, are all things that need to continue during COVID. And we can see how Leeds has really taken proactive steps to try and address some of those inequalities that have come out during COVID. There's a lot of myths around that during this, since March, that there's been changes to the expectations in health and care. So through the Coronavirus Act. So Leeds didn't apply the easements that were there, that they could have applied if they've demonstrated it was needed and it had been approved. And even if they had applied those easements, they would still have to look at that in a person-centred way and meet the needs so that it didn't breach people's human rights. So there are Care Act duties that would remain anyway, even if those easements were in. So promoting well-being, providing the information in a way that suits people, and advice in a way that suits people, involving the people if you're changing care and support plans, safeguarding, and referring and providing for advocacy. However, we advocacy has seen many less referrals for Care Act support, where you might have an advocate referred from social care because that person can't communicate the needs and they're having a Care Act assessment. And just a note on, it is possible for people to use a direct payment to pay family members to help meet needs if it's necessary and if it's effective. So, I mean, this will information on helping people to understand that you know, social care assessments are still happening during COVID. People can still apply for those for that Care Act assessment, and they can get advocacy support if needed to do that. So there's been lots of talk about changes to the Mental Health Act. There hasn't been, the Mental Health Act remains in force. There have been some changes introduced under separate legislation, reducing Section 7, discussions about Section 17 leave, discussions about the amount of people you need to authorise any restrictions. However, the British Institute of Human Rights was stressing that the need for safeguards when a person's already more vulnerable can't be overstated. So if you need information around the Mental Health Act and any changes that might have been put in under separate legislation, please contact us. But to reassure that it remains in force, because we've heard lots of myths about what's allowed and isn't allowed in this time during COVID. There's no changes to the Mental Capacity Act. So if somebody doesn't have capacity to consent to serious medical treatment, care proceedings, safeguarding, change of accommodation, there's a stress that some of the guidance that was updated in how to support somebody who lack capacity shouldn't become the new norm beyond the pandemic. No blanket policies, so care homes not just saying that certain things have to happen with everybody. There should be a proportional approach to all deprivations of liberty. It might be that usual care and treatment can be changed without a full decision required. There might be remote assessments. They still have to involve the views of the person that knows the other person well. Still has to be in the best interest. Still have to seek consent whenever possible on any decisions, and try and improve that person's capacity when they can. So there was a lot of talk about liberty protection safeguards being introduced, changes to the deprivation of liberty safeguards, and that was supposed to happen last year, but that's now delayed. It's another COVID delayed legislation, but that's likely to come out next year. So all those human rights things apply to all this legislation: right to life, right to be free of inhuman and degrading treatment, right to respect for private and family life. All those continue, but there have been some concerns, particularly in care homes, and we can see that from the recent care homes report around some of these aspects being affected during COVID. I suppose it's for us to be aware of that, how to support people to know their rights, how to challenge some of those. There's concerns about vaccinations and testing also within this group, who may not have full capacity to consent. Concerns about people are moving, being discharged quite quickly, life-saving treatment, isolation, lack of contact with friends and family. Please contact us, because I say I'm running through all this around any more detail on Mental Capacity Act. We've got Victoria here, who's an independent mental capacity advocate. We're regularly involved in national discussions about changes in case law, things like that. So there was some changes to NHS continuing healthcare, but that is now resumed. So they did have the Coronavirus Act allowed emergency powers around carrying out NHS continuing healthcare assessments, but that is now being restarted. So things like right to respect for private and family life, so choices about care and treatment discharge planning, right to be free from inhuman and degrading treatment, physical or psychological harm, right to livestock discharge into care homes where at the start of the pandemic, where there might have been concerns about COVID risk. some of these were all things that were concerns at that period, and right to non-discrimination. But that is now back in place. So we know that the care home guidance has now been updated. There's care homes reports. This is an area that is of real concern to everybody, I think. So there was caseload during the pandemic that highlighted that there should still be that communication with residents, enabling them to have that connections with their friends and family, finding creative solutions. There's some brilliant examples in Leeds of some homes doing that, but it's really different between different areas and different homes. Absolutely blanket decisions not to consider hospital admission or do not attempt resuscitation orders aren't permitted. And people living in supported living must follow the same legal requirements as everybody else. I'm not going to go into that in too much detail. So there's a health complaints advocacy service. This is funded from Health and Care to tackle issues, to raise issues, to make improvements. Health and Care want this to be in place. I think during COVID, everyone's so supportive of our NHS that they felt making a complaint might just add pressure on the NHS, and it wasn't to be done during this period when the NHS is under so much pressures already. However, Health and Care want these complaints to come in so that they can know about issues and make improvements to those. We've seen many less referrals around that. So there was a pause in the NHS England NHS Improvement being able to take on cases, but that reopened. So it's now fully reopened, and it's important that people use these referrals. So where things are going to a health complaint, and we can support people to follow that process and take off all the stress for them in that. Health and Care want to find out about issues. They want to be able to tackle them. They want to make improvements, even during COVID. It's, I suppose, partly getting that message out to people. So advocacy continues during COVID. There's still a legal duty for advocates to meet around the Mental Health Act, or where it's practical and appropriate in the Care Act or Mental Capacity Act. And service providers need to facilitate this. So they need to look at creative approaches to helping them to do that. Advocates are key workers during the COVID period, and they've got a range of very flexible support to enable that advocacy to continue, even when it might not always be face-to-face. Please contact us for referrals or advice. So I suppose that's the quickest run through on some of the legislation and what's not changed, because without having knowledge on what's not changed and not changed there, it's difficult for you to support people, to understand their rights, to challenge them where necessary. So I suppose it's down to you to see, have you seen any themes in these areas during this period? Do you have any concerns? Is there any areas that you would feel you want more information on to help you to support your community to understand and maintain their rights or raise issues in the next coming period? We're heading for a challenging period coming out of COVID, and also with cutbacks. How can advocacy support you to do that? We can do a longer presentation in February, and if there's a particular area you want more information on, we can cover that in much more detail. So I suppose it's just trying to hear from yourselves about what you feel is needed, or any questions from that. Is there any areas of that that around legislation or around that you would want more information on going forward? Or do you not want anything else on brands?
You covered it all, Wendy.
I thought that was a great overview, Wendy. Thank you.
I'm really sorry it's such a quick overview, but I'm trying to do it in 20 minutes. I suppose you all know about these areas of law and legislation, and we need to know about them in order to support our people to challenge effectively. So it's just a bit of an overview just to see if there's any areas, like for example around Care Act, that you might want more information on in future, or anything that you've seen that's been particularly concerning during this period?
Wendy, one quick question came to mind under the Mental Health Capacity Act was vaccines. Would that person have capacity to make that decision, and what would happen in that event? Not a question really, just a comment about what would that look like. Will you be sharing those slides, Wendy?
I can share them, but somebody else was doing that presentation, so I have had to do it quite quickly. So I would want to update on the Mental Health Act. But what we're going to do, if we know what's needed from the communities of interest, we can do a resource on rights and legislation for you to support people. So we can do one for users and one for staff as a summary, and share that through Forum Central so that that's easier for people to access. So if you feel that that would be useful, we can create that for you, put that on Forum Central.
I was just asking, as a colleague in public health who's trying to bring together some understanding of what research has been done to understand some of the impacts, and I would have just shared it with her. I wouldn't share it more widely unless it was okay to do so. But I do think having resources that help people at different levels understand and engage with that would be really helpful.
Thanks, Sam.
So
Can I just say, yeah, I know when I was working as a mental health advocate, there were issues around the COVID vaccine, and I worked particularly on the wards where people may also have lack capacity in certain areas. So they were sectioned under the Mental Health Act, but they also were assessed as lacking capacity for certain areas. And I do know that on speaking to the consultants at the time, they said they were trying. Well, they were not forcing people to have the vaccine, or to have the test. And there were also some concerns regarding delays in discharge, because the care homes would not accept the residents without having the tests. So they couldn't force them. So all they could do was, the staff members could only try to persuade them to have the test. So I'm wondering if it's going to be something similar with regards to vaccine.
So there is discussions nationally around among advocacy organisations, and there's some guidance produced that Voiceability are putting together on capacity and vaccines. So I can share that with you. So there has been a lot of discussions around that when somebody has capacity to consent to that. So I'm happy to share some of that, and I'll just share it with Forum Central for now. But if you want to contact me, we can have more of a detailed discussion. It's a discussion that's going on nationally, so there's lots of information on that. If you all feel I'm conscious we've now slightly over time. Oh, we're doing so well as well. If you want to, I'll maybe put Forum Central when they're sending out the notes. If there's anything that you feel you want more information on, if you pass that on through Forum Central or to myself directly, I suppose it'd be really useful to know in what format any information on rights. There's some brilliant myth busters out there on rights, which I can share. So that then we can do another presentation in February, but back that up with a resource that your staff could use, and a separate one that you can share with users. But really more feedback from yourself would be really, really helpful on that, so that we can make something that's useful for your communities.
Thanks,
So
Wendy.
we're slightly over time, and I know we're going to look at the agenda for next time and confirm a date.
Yeah, so do people want to have another meeting before Christmas on the 22nd?
Oh, it's very close to Christmas, that,
yeah,
isn't it?
most people might have finished by then, so should we do January instead?
Yeah.
Break our 2-week rule. Okay, we'll do that. Thank you.
Yeah. So shall we go to the first week in January or the second week, 5th or the 12th? What's people's thoughts?
I'll have more to say on the 12th. I won't have that much to say on the 5th.
Yeah, 12th, I can see some nodding. Yeah, thank you. Sam, we've got 3 minutes. Do you want me to, I don't know how do people want to see this infographic, or do you want me to send it out?
I mean, I'd quite like to see it if we've got time. Is there anything on, I suppose one of the things that we did want to do was decide on what was on the agenda for next time as well.
All right. Sorry, Wendy, I think I've ploughed ahead. Any thoughts for the agenda in January?
I would say definitely keeping vaccine discussions on as it progresses. Every week seems to be different. I think that's what we're all kind of eager to sort of see what happens.
Yes, I think as well, I think a lot's going to come out over the next few weeks, isn't it? A lot's going to change. So yeah. Usual
And also
catch
maybe
up.
if there's another lockdown after Christmas, if there potentially are any increases in the virus and what might happen in communities.
Yeah, I think normally Pip comes along and does a bit of an update on the numbers on each session. So yeah, hopefully we should have that as well. Can I just mention as well, so because myself and Daisy both work on the communities of interest, are you all aware that we've got the communities of interest inbox? And if anybody has got anything to send in, if it can go to that inbox, just thinking Daisy's on leave next week. So if anybody does email her with anything, and we both access the communities inbox as well.
I've got a bit of request. Sorry, from the teams, we're putting together our community-based support guidance, so guidance for staff. You're thinking about PPE, how we're going to connect with service users. So I'd be really interested to see if any other organisations are at that point yet, and I know that they are. Could I put my email address on the chat just to help kind of pick their brains a little bit? It'd be really good to have some support with it.
Yeah, sorry Rachel, I just missed the first bit.
Oh, sorry. Yeah, we're developing our community-based support guidance. So I'd like to pick someone's brains who's already out in the community and doing face-to-face work and support group work. We've been a little bit slow off the bat with it, but we want to get it right. That's why.
Yeah. Okay.
Yeah.
Do you know about some of the neighbourhood network schemes that are doing community-based?
We've got the odd ones. So yeah, I know that Opal have opened up, so we're going to have a chat with them to see what their guidance is, especially for staff. But we want to make sure our staff feel comfortable. We want to make sure it's a consistent service. So really, it's a lot of effort into making staff feel that they can deliver that service, and whether anyone's access PPE to help with their to help staff to feel protected as well.
Okay.
There's loads of stuff coming through. Thanks so much already.
I know that's something that Pippa brought up before around making sure, I mean, it's part of the purpose really of the communities of interest, isn't it? That we can support each other to share examples when we're not reinventing the wheel each time, you know, sharing, you know, risk assessments or guidance on those kind of things. So I suppose it's just how Forum Central can support us to bring all that together.
Right, that's great. So we've gone a minute over. So Sam, I'll share that infographic around and see if we get
Kate,
some.
if you can hold off sharing it, I've got it all in a zipped folder with all the translations. It's much smaller document to share. So I will be emailing that after the meeting that I think that you're in as well. So it'll come out today.
The next meeting.
All the other information is key.
Yeah.
It'll come out today with some other key information that will help people with different languages to access key information, all in one email.
Brilliant.
Is there a way to feedback into that and to feedback comments then, Sam? Or is there particular things that you want us to look at or comments you want on that?
You could have a look at the infographic and the information. We're thinking about developing an audio or a video and having that translated to help build on that, because we found that's worked really well, and self-isolating has been very difficult for people to understand. But also in the new year, we're reviewing a lot of our resources. So I'm not asking you to look at anything in addition, but just have a think about resources that have come out so far and what could be done in future to help priority groups and communities. So if I can have that feedback in the next meeting, we'll be able to help shape what we do going forward.
Fabulous. It'd be great to have clear questions on that, and then we can just separately in a separate email.
No problem.
So we managed to keep more or less to time, but we're a little bit over. So sorry to have to rush that last bit. But we're 2 minutes. I think we're over now.
I just wanted to say thank you to everyone for being part of the network this year. It's crazy to think that it's been going since April, I think it was. But yeah, I think it's been amazing to bring sort of all your communities to the front of what's going on. So yeah, thanks for turning up every 2 weeks, and I hope you all get some rest and time off as well over Christmas or yeah.
Can I just say thanks to Forum Central as well, because I think the Communities of Interest has been such a strong network, and it can be used so much more, you know, going forward. And we've got that space to think about how to use it and how to plan how it develops in future. You know, that would be great.
Definitely, yeah, we definitely need to think about yeah, where we go with it next, but it's definitely not going away anytime soon. So.
No.
Everybody have a lovely Christmas then, and I think we're wrapping up.
Thanks, Wendy, for sharing.
Absolutely. Happy holidays.
Take
care.
Bye.
Thank you. Bye.